Hello everyone, I am Dr. Sonali Bhave, consultant ophthalmologist, director of Aditya Eye Care Clinic, Udaynagar, Nagpur. I am here to tell you something about diabetes and diabetic retinopathy. We all know 14th November is celebrated as World Diabetes Day in the memory of Sir Frederick Banting, who discovered insulin with Charles Best in 1972. November is National Diabetes Month. Diabetes has become pandemic now. Number of patients in the world is around 537 million and in India it is 77 million. India is deemed as world's capital of diabetes. It is a matter of concern now. What is diabetes actually? Diabetes is a disorder in which there is increased blood glucose level. Now how does it occur? There is an organ called pancreas in our body. It secretes insulin. Whatever food we eat, it is converted to glucose, and this insulin converts the glucose into glycogen, which is stored in liver. If there is some problem in our pancreas working system, the insulin production is suffered and hence the glucose level is not controlled and the level increases. This is nothing but the diabetes. Now, diabetes has been categorized as type 1, type 2 and gestational diabetes. Type 1 diabetes is genetically controlled. It is transferred from one generation to another generation, and the therapy is only insulin. So right from childhood, patient has to take insulin. Type 2 is acquired one. It occurs because of any changes in our lifestyle, lack of exercise, stress and improper diet, eating of junk food. All this leads to diabetes. Third one is a gestational diabetes. Now gestational diabetes generally occur during pregnancy. Now how is eye associated with diabetes? Diabetes harm other organs like eye, kidney, blood vessels, nerves, etc. In eye, so this is how does our eye look. Externally, eye looks like this, and internally it looks like this. So this yellow colored structure which is visible here, it is the retina, and these fine blue and red color, these are the vessels. The strength of blood vessels is decreased in diabetes. So there will be leakage of blood into the eye. Now this is diabetic retinopathy. Like patient will have symptoms of decrease in vision, blurring of vision, poor vision at night time. There will be black spots that can be visible in front of eye, defective perception of colors. These are some symptoms. How can we detect diabetic retinopathy? There are some investigations and examination. Whenever patient suffer from these kind of symptoms, he should consult an ophthalmologist as early as possible. What an ophthalmologist do? A complete fundus examination is done at the first level. In fundus examination, we observe this retina, status of retina, how is the blood vessel, is there any leakage, and all these things. The next investigation, if we find that there is some problem, there is some leakage, fundus fluorescent angiography is done. This angiography will tell you, is there any fresh leakage or not. This angiography is similar to the cardiac angiography. We use it for detection of any blockage in heart. Now this angiography will detect any leakage is there or not. The next investigation is optical coherence tomography. This is very useful investigation and it's a non-invasive one. It tells us about the thickness of retina. Is there increase in thickness of retina because of diabetes? Is there accumulation of fluid inside it, and so on. how we'll treat this? Treatment has been categorized according to the stages of diabetic retinopathy. So early stage and later stage. In early stages, there will not be any symptoms of vision loss and all these things. So initially the treatment will be controlling of blood sugar level and follow every 6 months or every 1 year. If this early stage advances, the patient may have some leakage in the retina or small leakage. So that can be controlled through injections. These are the Antivision injections. Generally, it is used to prevent new vessel formation and to prevent the leakage. If there is still leakage occurring and there will be sudden vision loss, in this case we will have to do retinal surgery, and in that we generally do vitrectomy, and if any other damage has occurred, we prefer the surgeries accordingly. How can we prevent diabetic retinopathy? Diabetic retinopathy occurs after diabetes. Now diabetes cannot be cured, it can just be controlled. So how to prevent it? In this case, prevention is better than cure. Try to modify your lifestyle, increase exercise duration daily, take proper diet, take proper rest, don't take much stress. This will definitely help pancreas to maintain the insulin level. Thank you.